Also recognizing the emerging body of evidence in 2015 is the choreography of care. As a lay rescuer, as a single provider, when accessing and interfacing with 911, there's clear recommendations and support that lay rescuers should immediately and simultaneously recognize unresponsiveness, activate the emergency response system, and provide effective quality CPR. In addition, at that critical moment, the importance of connecting with the 911 operator as they can provide dispatch instructions to that caller to carry them and walk them through how to do chest compressions in case they're unaware of how to do it properly. And that life-saving importance of the pre-arrival instructions, or what we term dispatcher-assisted CPR, is one of the highlights in the 2015 recommendations. And key to enable that is having the dispatchers be able to effectively diagnose a cardiac arrest by focusing on the ascertainment of agonal respirations of the patient through the information provided by the caller. Again, in 2015, for the lay rescuer basic life support provider, is the emphasis on quality CPR. Clear evidence that shows that chest compressions to be provided at an adequate rate and adequate depth, allowing full chest recoil and minimizing interruptions in chest compressions, and all the while avoiding excessive ventilations. I'll return back to this, but it's important for the lay rescuer and basic life support to push hard and to push fast when they're dealing with someone in cardiac arrest. There's also recognizing the evolving burden of risk and injury associated with opioid-associated life-threatening emergencies, having some kind of strategy in very precise situations and precise environments of bystander naloxone use in opioid-associated life-threatening emergencies. It's important for resuscitation stakeholders in Canada to understand that at present, bystander naloxone is still a prescription-only medication available within Canada. And we look forward to working with stakeholders and moving this initiative along across Canada.
Yes, so the chest compressions are for cardiac arrest. Opioid overdose is respiratory failure. Like, there's hundreds of causes of respiratory failure. And if you're breathing, it proves your heart's beating. You don't give them any chest compressions ever. So here's my moderated comment that's been up there for years. I was at this conference. Dr. Aaron Orkin, who has since recanted and said rescue breathing is what saves people's lives, at a coroner's inquest in December 2019. Anyway, Mr. Orkin and these people at Public Health that have been teaching chest compressions only for a respiratory emergency are out and out crazy, because they're killing doctors and everything. She sent this to me to Heart and Stroke, and she sheeted to these people here. Anyway, they're crazy. Because a respiratory emergency is not a sudden witness cardiac arrest the only time you give chest compressions only. And that's the way it is. It's all up here for you to have a look-see. I was publishing the 2015 AHA and ILCOR guidelines about what they're doing. Anyway, there's Orkin's PowerPoint in 2015. The man's nuts. Nuts. He was even recorded. I'm an emergency physician. Rescue breathing's very hard for me to do in EMS. It's just too difficult. Well, they teach it in Boy Scouts and Girl Guides. This is pulmonary edema, lack of oxygen, any respiratory emergency. Yes, sir. It'll kill you, pulmonary edema. Yes, sir. That's why you ventilate. Anyways, they're all crazy. And every nurse knows it's murder. It's causing post-traumatic stress disorder. All the reference from the 2015 guidelines, AHA and ILCOR, there's 70 some odd All says rescue breathing, rescue breathing, rescue breathing. Of course, because it's a breathing emergency. Yeah, anyway, they're wanked. And nobody says anything. Well, hardly anybody. There's a few people. Mayor of Toronto and medical officer of health said stop murdering everybody years ago. Anyway, have a good one. And breathing's a very important thing. Gotta breathe in an emergency, give them air. There's nothing wrong with the heart.